So I didn't know much about childhood dementia. I didn't know anything about childhood dementia until maybe 6 years ago, to be honest, when I started talking with families, a mom in particular, who has 2 kids with this form of dementia. And it's pretty horrific. It's just, think Alzheimer, Parkinson in a 5-year-old. So, and having had a kid around that period, I've sort of like really projected, my experience and, in comparison to what these families I'm talking to experience. And so in general, the kids are born healthy, or they look healthy, and they tend to be okay until 4 or 5 years old, depending on the kids more or less. And after that, they start losing the words and everything they've learned in this early stage of life. Therefore, what we call it dementia. And it comes with a lot of pain, not only for the kids, but for the family. And they die around teenage, around 14, 15 years old. So this family came to us and heard about the work we're doing and asked us, how can we help? And of course, we wanted to help, and we got some funding to start a project on this. And what we've done is, a couple of things. The first step was to work with the families and the kids with the disease and collect their skin cells and then reprogram them into this brain tissue I'm talking about, these brain avatars from the kids. We did the same thing with healthy kids, all Australian kids. And talking to the family was very clear. So it's a genetic disorder. So the cure is going to be genetic, like gene therapy. And there are clinical trials that are already ongoing to use gene therapy to treat this disease. And I hope they will work, but at the moment, the results are somewhat encouraging, but only when you treat the kids very early, like around 2-3 years old, which is devastating for the families because most of them are diagnosed around 4 or 5. So talking to them, we're like, look, we get it, a cure would be fantastic, but we'll settle with anything that can help improving the symptoms. So it's quite unusual. Usually you really want a cure, but in this case, anything, they're so desperate. It's such a hard disease with no treatment at all, by the way, that, if we can find a treatment that can help with their day-to-day life, it'll be a big win. And the second thing is they want it now or yesterday, really. You can imagine if you're a parent with a kid diagnosed with a terminal condition, but this ugly chronic condition that you, over time, every day, you lose a little bit of who the kid is. They eventually forget their parents. They just don't even recognize them, or barely, or sometimes they do. So they want something very quickly. So the way we're trying to approach that, and we're working with pediatricians and a lot of people for this project, obviously. And so we've looked at a bunch of drugs that have been developed for other conditions, and we call that repurposing treatments, and try to see if we can test these drugs on the brain cells, the brain avatars of these kids. And we've identified a few and trying to see if that can go through clinical trial. It's important because, and it's important for several things. First, it can address the symptomatic problems, so it can potentially help with the symptoms and help day-to-day life, even before we get a total cure. And also it can be very fast because it's repurposed, meaning that it's already been used in other clinical condition, so it's been tested in human already. There's less, like IP involved, which can slow down the process sometimes. So we think that might be the right way to give some help to these families.